Okay, so now we're going to talk about Chapter 9, which is Information and Knowledge Needs of Nurses in the 21st Century. So the objectives. Define nursing informatics, describe the goal of nursing informatics, describe how clinical information technologies are and will impact nursing practice, explore how nurses can create and derive clinical knowledge from information systems, and speculate on the future of nursing in the context of health informatics. So now we're going to talk about the goal of nursing informatics and the impact it's going to make on our practice. Okay, information production and access. The information and knowledge informing 21st century of healthcare delivery has been growing at an unprecedented pace in recent years. Extended and expanded access to clinical research findings and decision support tools has been significantly influenced by the advent of computerization and the internet. So what does this mean? It means we can get information really, really quickly. And there's a ton out there. You can post information really, really quickly, and not all of it is filtered. So it's really important to understand that. There's lots of producing of information and quick access to information. So now it's a matter of finding the good stuff and also putting up the good stuff so you don't misinform people. Working in environments of increasingly complex clinical care and contending with the management of large volumes of information, nurses need to avail themselves of the technological tools that can support quality practice that's optimally safe, informed, and knowledge-based. So we need to make sure that we're using good technology and good information to take care of our patients. We're not just doing whatever Google or Wikipedia tells us to do. So the global definition of nursing informatics. Nursing informatics science and practice integrates nursing. It's information and knowledge and their management with information and communication technologies to promote the health of people, families, and communities worldwide. So nurses identified informatics roles typically focus their efforts on articulating meaning of clinical nursing data and information structures that can be codified and processed. So what data is clinically nursing specific, and then how can we code it and process it to present the information in a standardized way? We identify the information processes associated with nurses' work, and looking at process is just as important as looking at outcomes. So what are we doing to make sure that the patient is taken care of? And is that process efficient? Is it safe? And is it reproducible and cost efficient? Determining ways in which information and communication technologies can be most effectively utilized to support the capture, retrieval, and use of data, information, and knowledge. So what are our informatics needs? More timely access to data and information, clinical and financial, has been identified as a necessity in the climate of the 21st century healthcare delivery. Health service organizations, societies, and governments throughout the industrial world are charged with assuring that healthcare delivery is safe, knowledge-based, cost-effective, seamless, and timely. And in this world where we have so much technology and so much knowledge, these errors really aren't expected and allowed at this point. Informatics helps us be safe. It helps us use the best knowledge out there. It makes us cost-effective, seamless, so we can transition from care level to care level, and we can do it in a timely manner. So while involving emphasis on issues such as chronic disease management and aging, at-home informatics can encompass the use of technologies to empower citizens to more effectively manage their health and wellness. I know that sounds crazy, but men and women everywhere now have this opportunity with technology at their fingertips. We can help people take ownership of their chronic disease and self-manage them without the need of being tied to a doctor's office or a home health nurse or some other costly healthcare tool. Informatics is going to be the dawn of the future in chronic care management. An additional challenge within the nursing profession is the pending human resource crisis and dire projections of imminent shortage. So think about how there's not enough primary care providers. There's not enough nurses. So you can focus on IT to elevate the central means by which nurses can sufficiently support their work environments. Instead of having one tele-tech per unit, now we have a telemetry center that uses multiple people to monitor a bunch of different telemetry. IT has the potential to reduce the waste of valuable nursing resources by reducing the time spent in the care and feeding of patient records, having more time for direct client care and less paperwork. Of course, workarounds don't help that, and so informatics looks at those things. Nurses definitely fall into the category of knowledge workers. Studies have identified that depending upon the setting, nurses spend anywhere between 25 to 50% of their day managing and recording clinical information and seeking knowledge to inform their practice, whether that's looking up old records to see what medication someone's on or learning about a new way to perform a nursing duty. With the advent of clinical information systems, specifically electronic documentation and clinical decision support applications, every nurse has the capacity of contributing to the advancement of nursing knowledge on many different levels. So, creating clinical knowledge. Nursing knowledge is simultaneously the laws and relationship that exists between the elements that describe the phenomena of concern in nursing and the laws or rules that the nurse uses to combine the facts to make clinical nursing decisions. New technologies have made the capture of multifaceted data and information possible through the use of technologies like digital imaging, with photography to support wound management, and now part of the clinical record, such as images, adds a new dimension to the assessment, monitoring and treatment of illness. Can you imagine if we could record someone's lung sounds at the beginning of the shift? Can you imagine if you could say, they sound way worse than this morning? These are a few emerging capabilities that allow for numerous data inputs to be transposed, combined, analyzed, and displayed to provide information and views of clinical situations. It's currently not possible in a world dominated by hard copy documentation. So imagine if we could just listen to the previous lung sounds. How cool would that be? Be able to really dig deep and take better care of our patients. Empirics. This is access to factual knowledge derived from repositories of aggregated clinical research findings and integrated within the clinical informatics systems. Aesthetics, access to multicultural practices and beliefs. And personal, access to personal repositories of clinical experience and reactions. So that's when you go back deep into your own anecdotal time to use information. Aesthetics is kind of like, those sacred cows that sometimes we don't need to hang on to. Creating clinical knowledge. Ethics. Access to standards of ethical practice, but also access to experts in the field of moral reasoning to guide interaction. In each and every instance of interacting with the clinical information system, a nurse will add further to these repositories of knowledge on the basis of their daily clinical challenges and queries. Evidence-based practice and research utilization are concepts which have been widely addressed in the nursing literature. Best practice guidelines hold much promise for the future, but again, in their typical form of paper volumes and often unsearchable online versions, resources will not realize significant adoption by an already stressed and stretched nursing resource. The profession has been steadily moving towards consensus on the adoption of data standards, and recent work suggests that we are achieving significant strides. Consider that as clinical information systems are widely implemented as standards for nursing documentation and reporting are adopted, and as healthcare IT solutions continue to evolve, the potential to synthesize findings from a variety of methods and worldviews becomes much more probable. Clinical decision support tools have evolved beyond the previously prevailing notion of accessible reference texts and written resource materials like policies and procedures. Most available clinical decision support for nursing practice, although promising, are simplistic and early in development. We need to get deeper with that. So here are some clinical decision tools. Computerized alerts and reminders like, hey, medication's due. Oop, they're allergic to that. Don't give it. Oh, this potassium level's abnormal. Clinical guidelines, so best practice. So if you put there that someone's Braden score is 20, it's going to pop up, reminder to turn your patient. Make sure that their skin is dry. Make sure that you have barrier cream. There's online information retrieval with things like drug information, Synol, up to date, clinical order sets and protocols, and online access to organizational policies and procedures. That's super important, but sometimes when it's hard to get to, you're not going to use it. So here are some data input devices like biometrics, voice and video recording, voice-to-text files, medical devices. How great is it when those infusion pumps help you double-check your work and calculate your drip? Your barcode technologies. Barcode technologies decrease med errors to almost 0% at the University of San Diego in California Medical Center. Telehome care monitoring is awesome for diabetes and chronic disease management. I use the blood sugars right now for my patients. We're in a pilot program that's awesome. So what's the leadership challenge? The field of nurse leaders in health informatics has markedly grown in the past 2 decades. For several years, nurse informaticians have advocated for the need for all nurse leaders to become knowledgeable and engaged in the studying of the direction of informatics. It's really hard for your manager to mandate that you do a bunch of stuff and they don't know how to use it. They are in the field with you and can help you. Informatics is not just going to be done in the specialty level. Everybody's going to have a grapple of this information so that we can better disseminate and take care of our patients. So that's a leadership challenge. If you're in a leadership role, really digging deep and kind of hurdling over that in health informatics and learning exactly what you can do to get better at this skill. So strategies for leadership. Identify the informatics education needs of nurse leaders. Develop mentorship programs for the acquisition of informatic leadership skills. Assure enrollment of nurse leaders as sponsors for electronic health records initiatives. In clinical practice challenges, despite many valiant efforts to implement comprehensive CIS throughout North America, there are still many provider organizations with limited online functionality available to nurses. Over the years, nurses have been on the receiving end of systems which either did not add value to their work or by virtue of poor design created additional work, and we can all raise our hands to that, right? We need to be in there giving our input so I can say, hey, listen, it's really hard for me to be in the ICU managing drips, turning my patient, dealing with intubation, and then also having to document vitals every 10 to 15 minutes on this really crazy, complicated, arduous electronic system. So if you want me to work better and work smarter and probably not quit, you need to invest your money in a better EMR. That's a legitimate complaint. Opportunity to avoid future installations of IT solutions that do nothing to benefit and support the clinical practice. We really need to make sure that you can stop that before it happens. It behooves nurses to be engaged in the acquisition, design, implementation, and evaluation of your clinical information system. You want to make sure we're using the right one. It's really easy for somebody to just choose a program, especially when they're not in the clinical field. They don't understand why some things are going to be a barrier from the office as opposed to when you're actually in the clinical setting. You should be encouraged and supported to participate in the acquisition, design, implementation, and evaluation process of your CIS. And I got involved with this too. I was having a lot of trouble adopting my IT solutions into my everyday care. So becoming a part of the solution instead of just complaining about it has really helped me to understand and also shape our organization's use of our EMR system. So what are some challenges for education? Over the years, numerous efforts have been undertaken to identify the core informatics competencies needed by nurses. In recognizing nursing informatics as a specialty, the ANA has articulated the scope and standard of nursing informatics practice. Recent studies of schools of nursing indicate that few basic nursing education programs have embedded the concepts and processes associated with informatics. So congratulations, you're in a program that actually talks to you about informatics, and hopefully you'll understand it more by the end of this. A presumption is often made that future graduates will be more computer literate, so that they don't really need to learn this stuff. And even though that might be true, computer comfort doesn't equate understanding and facilitative and transformative role in the IT that we'll have in the future. So we need to share prototypes of informatics in nursing school. We need to get you guys involved in learning how to pull lists, look at population management through the IT functionality. Consider interprofessional education opportunities in addressing informatics. Faculty, we need to be obligated and supported in the attainment of basic informatic competencies. Seek and allocate funding for development of innovative curricular models and incorporate accreditation criteria that necessitate an integration of informatics core. So view for the future, overall it's fair to say that the majority of nurses have yet to embrace the informatics notion. With the availability of rich data repositories, there will be opportunities to grow.